members, so we need one more to have a quorum to conduct any business. But the neat thing about our commission is that we're kind of in an information gathering point in time. So we're going to gather our information tonight, and we will share that information with the other commissioners. But fortunately or unfortunately, we won't actually conduct any business, but that's okay because we're not really there yet with where we are on our items. So we'll go ahead and do a roll call, and we know where that will go. So,
Commissioners Fahey. Here. Hearns. Latanzi. Wiley. Here. Vice Chair Fluke. Chairman Derryberry.
I'm here as well.
We do not have a quorum.
Okay. So, well, let's stand for the Pledge of Allegiance, and then we can hear our presentations. So if everyone can place their hand over their heart. Tomorrow is the 4th of July. Repeat with me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, so let's go ahead and move on to our presentations then. We have from Senator Scott Wilk's office, Richard Cook. You're first up. Come on down.
Thank you, Chairman Derryberry. Thank you, Commissioners. I am also first and third because I'm representing Assemblyman Lackey as well.
Perfect. Two birds with one stone.
Yeah. So apparently you needed what was going on legislation-wide in the state of California with cannabis. So after I'm done with this, you can have this, Elizabeth, if you want, and same thing with Assemblyman Lackey's letter. To give you kind of a quick update, and it is really just an update as end of July. Who knows if these bills will move any farther.
Sure.
So there is AB 64, and this is from Senator Wilk's desk. AB 64 is in the committee process. It's in appropriations right now. Quick summary, it makes various changes to cannabis statutes, including requiring a licensed cannabis business to display a sign educating its customers on California laws on transporting cannabis or cannabis products in a vehicle, allowing state trademarks to be issued for cannabis goods and services, and permitting medical cannabis collective or cooperative to operate on a for-profit basis. Removes the requirement that licensed premises be separate and distinct for a person who has issued more than one cannabis license, and makes other technical clarifying changes. Alcoholic beverage are 21 years age or older. So furthermore, this bill requires the delivery network company's age verification system to be reviewed and approved by the Department of Alcoholic Beverages. And finally, the bill authorizes the ABC to charge an annual fee to cover the cost of administrating the review and approval program. That's AB 64. And Tom talks about that also. So I'm going to kind of try to roll both of them into the same one. Assemblyman Lackey has been active in his implementation. He opposed Proposition 64, but now that the voters have passed it, he's worked hard. He worked to make its impact as little harmful as possible. His focus has been on reducing drug driving, preserving local control for cities and counties that do not want legal cannabis in their communities, and protecting public health and reducing the size of California's illicit cannabis market, which remains large because the criminal penalties have been significantly reduced. Assemblyman Lackey points to a study at UC San Diego that will examine levels at which a person becomes too impaired to drive, and a CHP task force has been dedicated to drug driving that is implementing best practices for law enforcement to detect high drivers and testing new technology like roadside drug testing devices. And there is $3 million in funding to train more drug recognition experts. Current research is conflicted on whether legalizing recreational cannabis increased its size. Statistics from National Survey on Drug Use and Health shows that use by teenagers has declined since Colorado approved recreational cannabis. The same survey states of teens, alcohol, tobacco, and heroin use are down sharply in the state as well. On the flip side, a different report from the Rocky Mountain high-density drug trafficking area says that Colorado youths now rank number 1 in the nation for marijuana use and 55% higher than the national average. Adult use in the state has also come up on the top 12, which a report notes an 124% higher than the national average. So you can see where there's conflicting reports coming out. So basically, we don't know. There is another bill, AB 2914, in status. It's in the Senate floor. It's on its second reading. We supported this bill. Senator Wilk supported the bill. It prohibits a licensed cannabis business from selling a cannabis product that is an alcoholic beverage. You heard about their fusing wine with marijuana. Ought to be a lot more fun on the road after that. Also prohibits an alcoholic beverage license from selling, offering, or providing cannabis, including an alcoholic beverage that contains cannabis. There is Senate Bill 162 in the State Assembly. It's in the committee process, appropriations. Senator Wilk also supported this bill. Quick summary: prohibits a marijuana licensee from advertising medical and recreational marijuana products through the use of branded merchandise. Assembly Bill 350, it's in the status assembly and desk process. Senator Wilk supported on Senate floor. Quick summary: prohibits edible cannabis products from being made in the shape of a person, animal, insect, or fruit to help keep out of the hands of children. We are also looking at SB 1451, the status assembly in the floor process on the second reading. Senator Wilk also supported this in committee. Quick summary: imposes specified penalties on adult use and medical cannabis retailer or microbusiness license that sells or furnishes cannabis to a person under the legal age or permits any person under the legal age to consume cannabis on the licensed premise. With that, any questions?
Do you guys have any questions?
Thank you so much. There's a lot of activity going on.
Oh, still.
Are you familiar with any of the current activity with the opioid legislation? Or?
I do have information on the opioid legislation as well.
Perfect.
That's in the up in the state capitol. If you want some status on some of the bills, AB 1998 status and assembly in the committee process. Health. Senator Wilk has supported this bill in committee. Requires by July 1st, 2019, every health practitioner who prescribes, orders, administers, or furnishes opioids classified as Schedule II and Schedule III to establish or adopt a safe opioid prescribing policy as specified. Requires the Department of Public Health to submit a report to the legislature by 2024 detailing progress toward reducing the overprescription of opioids. Senate SCR 68, chaptered by the state, Republican caucus has a support position. A quick summary on that: designates the month of September 2017 as Opioid, Heroin, Fentanyl, and Prescription Drug Awareness Month as specified. Senate Concurrent Bill 68, I'm sorry. Assembly Bill 2256, it's in the State Senate. Appropriation, we've supported this bill in committee as well. Authorize a pharmacy wholesaler or manufacturer to furnish Naxalone hypochloride or other opioid antigenics, and I'm sorry, you want to say that for me, Steve?
No, sir.
That can aid in the treatment of an opioid overdose to law enforcement agency if specified conditions are met. I never understand why a police officer can't automatically just have that in his kit, you know. Assembly Bill 182, it's in the committee process appropriations. The Republican caucus has a support position on this. Quick summary: requires the Department of Public Health and its consultation with stakeholders as appropriate to develop, coordinate, implement, and oversee a comprehensive multicultural public awareness campaign known as Heroin and Opioid Public Education, where they're calling that HOPE, upon appropriation by the legislature or receipt of a state or federal grant funding in January 1st, 2023. Assembly Bill 2486 is in the status Senate committee process. Health Opioid Prevention and Rehabilitation Act. This bill would, commencing on 2020-2021, require a manufacturer or wholesale that sells or distributes opioids drugs in the state to submit to the department a report including specified information that details all opioid drugs sold or distributed in the state during the preceding fiscal year. This bill, commencing in 2020, required the department in consultation with the board to calculate the rateable share of manufacturer or wholesaler, what is the individual portion of the collective sum of $100 million to be paid by the manufacturers and wholesalers based on the information reported. Assembly Joint Resolution 19, Status Secretary of State, this has been chaptered, urges hospital pain management formularies consider the inclusion of a range of non-opioid alternatives. Further urges the President of the United States and the Congress of the United States to move forward with legislation to establish multimodal therapy guidelines for managing post-surgical acute pain. As well as their Assembly Bill 1109, Status Assembly. Senator Wilk supported this bill. Quick summary: requires specified education courses for certain prescribers to include the risk of addiction associated with Schedule II drugs. AB 2859 is in the Senate Committee Progress Appropriation. We also supported this bill in committee. Requires a pharmacy that dispenses Schedule II, III, or IV controlled substances to display safe storage products as defined in the place of building premise that is located close to a pharmacy. And AB 2487, committee process appropriation. We support this bill also. Requires physicians the option of taking a one-time course in the treatment of management of opioid-dependent patients as specified to fulfill an existing 12-hour continuing education course required for license renewal. And finally, Senate Bill 833, it's been chaptered. This bill would require the department, subject to an appropriation of the purpose on the Budget Act of 2016, to award funding to local health departments, local government agencies, or on a competitive basis to community-based organizations, regional opioid prevention coalitions, or both, to support or establish programs that provide naloxone to first responders and at-risk opioid users. So I will give this to Elizabeth so she can put this in notes, if you wish, so you don't have to write that all down and remember.
I did start writing all the numbers down.
I also brought legislation on alcohol as well, as we're talking about alcohol in the Senate as well.
So I think, Richard, what it sounds like to me, cannabis is a moving target based upon what's happening generally with cannabis in California. But a lot of what you're dealing with in Sacramento with respect to the opioid crisis is more of it sounds like a lot of the legislation, proposed legislation, has to do with education, awareness, providing a plan of attack for pain management.
Right.
A lot of where this starts, it seems like, a lot of what we're hearing is, there's a back surgery that leads to prescription opioids that then leads to no more prescriptions because the doctors can't give it to them anymore, which leads to heroin.
Right.
That sort of thing. And that's what's bogging down our ER, the proposed legislation for the law enforcement to carry the rejection meds or whatever you want to call them. Those are all good things that we're hearing coming out of Sacramento. So thank you.
Just legislation. We'll see where it goes. And at the end of July, it
may all be completely different.
Yeah. Could all well be.
Thank you, Richard. It's now from Senator Steve Knight's office, Lisa Moulton, to give us any insight on what they're dealing with there in Washington.
Well, in Washington, they recently passed a lot of legislation dealing with opioids, which I did not bring because I thought we were dealing just mainly with marijuana, so which is a Schedule I drug, which makes it illegal.
Right.
And that there's no legislation that I'm aware of to change that. Marinol is a synthetic version of THC, which is the active ingredient found in the marijuana plant, and it can be prescribed for the control of nausea and vomiting caused by chemotherapeutic agents used in the treatment of cancer and to stimulate appetite in AIDS patients. And Marinol is a Schedule III substance under the Controlled Substance Act. So there's that. I will be happy to get the information about the opioids and get that to you. They
Sure.
just passed a ton of legislation on that. I would suggest, too, that I don't know if you have all have seen the documentary Chasing the Dragon. I would recommend that you find it and look at it. I recently was at the Reagan Library, and they did a whole evening on opioids, and it was very interesting. A lot of the folks that they interviewed started with marijuana. That's how it started. So they had a ER nurse, they had a DEA agent there, they had the chief of police, they had a lady who had lost a child due to the opioids, but marijuana was kind of the gateway drug there. So, but as far as what the legal status is of cannabis in the United States, it's illegal. So anybody that works with the federal government has to pass a drug test. I recently talked to a family member who is in Colorado, is in HR, and I just asked him, I said, what kind of issues are you having? And he said, we can't find people for jobs because they can't pass the drug test, and it's because of the marijuana. So it's having an impact on their economy because of that. So, which I know is not California, but, you know.
But it could be.
It could be.
As things are changing.
Sure.
It could be an
and
issue.
And any small businesses that work with like any of the big three in Palmdale, the contractors there, they, you know, it's a trickle-down effect there. So
they're all doing work every day for the federal government.
For the federal government, and you have to be clean. Sure. So, but I will get you all those things. But do watch that documentary, Chasing the Dragon. It was very informative.
Sure.
So.
Thank you.
Okay.
Okay, well, that takes care of our speakers for today. So, you know, I think obviously we're without a full, without a quorum, we're going to run short. So, looking at what to do next, you know, we'll recall last month we had Judge Estes, Dennis Vincent, representative from the Public Defender's Office, you know, a number of people from what they're seeing at the courthouse, in addition to the Tarzana Treatment Center, with what, you know, they're doing locally in the community. So, Liz, I know we spoke with Dennis Vincent, and he had some ideas, maybe, and so where did that take us?
I spoke to Dennis, and he said that he would speak to the courts to find out if they're interested in having a program created by those in the mental health field who work in drug treatment for those individuals who are charged with drug offenses, which is now a misdemeanor, and therefore they serve no time and have no mandatory treatment. Remember when he was talking about they just get released, there was an incentive for them to stay and do therapy because they got their case reduced. And so now they'd rather just spend the time and get out because that's just too much work. So the program would be a program that the court would require those arrested on misdemeanor drug charges to attend for the entire term of their sentence, and then their case will be dismissed upon completion. And of course, everything costs money. So I talked to Michelle, because Michelle works with all the social service providers in the Antelope Valley, to see what their thoughts are. For example, do they have programs in place? Do they have grants that they can get? What's their thoughts and feelings on it? And I just got a letter from Michelle. I guess she's applying for something for opiates. So I'm not sure exactly what happened, and I haven't heard from Dennis. It takes a little bit of time.
Right.
So I think that's one avenue. I think it's a good avenue to go and make a dent. I guess I'm not sure who has the statistics, and I guess I should look and find is how many people in the Antelope Valley are what we would consider abusing drugs, drug addicted. What drugs? Are they receiving services? In order for us to determine where the shortfall is in providing services to these groups.
Right.
I see one thing is that a lot of those are having to go down below to get services, and if you don't have a vehicle, if you don't have money to do mass transit, then how do you get there to get the services to help you if they're not here? Now, I don't know for sure, but I think I need to do some research on that to find out what services are being provided and if the people are really getting to those services in order for the commission to make an assessment of what they need to do in order to assist with the problem, if there is one.
Well, I mean, I think from what we've heard from the speakers the last 3-4 months is that, there is a problem. A lot of times the problem is masked by the prescription pain medications. A lot of times it's masked by, is it a mental health issue or, I mean, when I can't help but think about, I think the conversation that sticks out in my mind the most was, Dr. Larry Stock from the emergency department was here with Dr. Greery, and what the hospital sees, and then what we see on the streets when the fire department and the paramedics are on site. They don't know is the person high or is it a mental health issue, and so I guess maybe a lot of it is education and awareness, and how do we determine that? And what does it all look like? One of the things that it sounds like the state's trying to do is put forth these. September is Opioid Awareness Month or something like that. And I know we're getting close to September, and so for us to put together a package that provides some education and awareness to the community might be a difficult task, but maybe if it's not September like the state is hoping for, we can, maybe shoot for November or, early next winter to put forth some education and awareness. Anyways.
I can look into that for opiates and for cannabis. I'm not sure about cannabis in California, but maybe we should not be aware, or should we be aware?
Yeah, I just,
I don't know anymore.
It's crazy to me because we heard from our two speakers. We have the state of California who has a considerable number of proposed changes to the legislation relative to cannabis, and then from the federal level, it's still illegal. Mm-hmm. I know personally, for my business, one of the biggest topics, I renewed my errors and omissions insurance this year was do I have coverage for cannabis consultations? Because one carrier said no, another carrier said yes. I mean, it's an issue. It's a big issue. Because nobody knows where to take it. So I'm not sure as this commission goes, until we have some more finality in what's going to happen in Sacramento or Washington, D.C. as it relates to cannabis, do we try to tackle that one? I mean, it seems like it'd be a kind of a big mess.
We could do some awareness on methamphetamines and synthetic drugs.
Oh, absolutely.
Okay.
Yeah, I mean, it's being the husband to an emergency nurse. I've heard a lot of concerning stories and from and being friends with these ER doctors. I'm pointing like he was here, but these ER doctors, I can't tell you how many times I hear stories about what walks into our hospital and what's on our streets. I hate to say it, being right next to Station 33 here off the boulevard, those paramedics, they've got stories that would shock us all for what they see on our streets. So, I think the opioid, methamphetamines, that if we're going to raise awareness and maybe effectuate some change, I think that's really probably a good place to start.
Okay.
You said September, Rick, was that? Okay. You didn't memorize them? Well, I just appreciate you guys being here. It's so close to the holiday. So, what do you guys think?
I guess I'm alarmed that we got to have laws for it. But I guess that's what we need. I guess that's the state where we're at right now, that we need a law. But the awareness, I'm with you on that. The awareness, how do we bring closer awareness so that we can make this a healthy community? I think that's our objective. That's our goal. And if the law is there, enforce it. Let's get there.
Yeah, I definitely agree with an awareness campaign and piggybacking on what Sacramento is going to be doing. Going back to our previous speakers, I remember hearing that a good target audience was the high school aged group, especially focusing on the methamphetamine and the synthetic drugs, as they were the population at which all of our speakers identified that age group not being impacted, therefore likely the most powerful group to address with awareness and education, and possibly reaching them through their parents or through their teacher mentors might be helpful.
Sure.
And then as the commission continues at work, I remember our last meeting we were talking about the needs for beds. So I know that's on the back burner for us, and we have just ongoing concern and interest in that aspect of promoting the health of Lancaster with regards to drug abuse and drug treatment.
Sure. So who do we want to bring back for us next month? Is there anyone else in the community we need to hear from, or do we need to maybe table the presentations and have more of a roundtable discussion, with the full commission?
I was thinking maybe we could bring all the groups there, because I think we heard them in different elements, but maybe having all the sides kind of speak at once. I mean, because one says this, one says that, not that they're wrong, but it was all important information, so you can get a more directed challenge. So we can pick a baseline. Are we going for a zero tolerance? Are we looking at, we like to say, get it down to 10%, something tangible that we can work towards. Zero would always be the ultimate. But, maybe having everybody hear from different sides, that's what I kind of picked up, is that maybe we have us all and then go to that round table to say, this is where we are headed. Because everybody all the stakeholders have a very important part, and that part of the puzzle, not one part is not any more important than the other, but we want to make sure we paint a very strong and diverse picture that, makes a collective stronghold of how we want to make the San Luis Valley look and going forward with it. That would just be a part suggestion, but I like the round table, but having us all kind of hearing the voice.
Now, there's not a way we can conduct a meeting like that in this setting. I vaguely remember a different commission that we had to call the meeting something different, and it wasn't an agendized commission meeting. And anyways, and it allowed us to have like an open discussion with invitees only. I don't remember how. I don't know. We might have to talk more about.
It would be very difficult to get all of those people at one time, because they all are very separate in their discipline.
Right.
I could not get them all. I couldn't even. I barely got what I could get together. It would be difficult. We do need to have, though, a discussion, I think, at the next meeting on if you're going to raise awareness and change and whatever, how do you exactly do that? We like a brochure,
classes,
all the methods,
wellness homes.
Yeah.
Why don't we do this? So why don't we table the need for more speakers? I mean, I can't think of really any group in the community that we must hear from. I think we've heard a lot of the same things with respect to the problems. I mean, sans what we heard tonight, but a lot of the community stakeholders, whether it's Tarzana or Mental Health America or the emergency department or the paramedics, fire department, whatever, we heard a lot of the same things. So why don't we just continue this topic? How do we take our next steps? And it's not fair if we can't make a decision on that today anyways. We don't have a quorum. So why don't we just bring us back next time without particular speakers to try to formulate what that looks like, this awareness or these classes or this brochure, who did we give it to? so that we can, or maybe we get behind Dennis Vincent's program for the drug rehabilitation. Funny, real quick story. I'm on the 3rd floor of the courthouse waiting outside to have my matter called, and the courtroom was a mess. It was real chaotic. So I was sitting in the hallways. It was quiet. So I'm kind of down there, and I had my tablet, and I'm doing some work, and I hear this public defender talking to her client. And there was a bit of a language barrier, so she was speaking really loudly. And I hate to say, I wasn't intentionally eavesdropping, but I heard absolutely everything that happened in the conversation. And it all had to do with this gentleman who just got busted for some drug offense. And she was basically, it had just been arraigned. He was out on bail, or maybe there was no bail. I don't know. But the long and the short of it was, she's basically reaming him. You can't use drugs. You can't, whether it's cannabis or meth, or you can't. And she was just, and it was like a 20-minute, almost comical conversation, but sad at the same time. But I imagine that's the same thing that the DA and the public defenders and Judge Estes are dealing with in the drug court, trying to educate these defendants who were brought in for maybe the now misdemeanor drug offense. So maybe that's a way we affect change. I mean, this gentleman needed it. It was clear. His fiance was playing interpreter to the PD, and I unfortunately heard every word that was said. But anyways, it's clearly out there. So why don't we do that? Let's have hopefully we can get all 6 of us here next on August 7th. Let's table the community discussions and presentations. I think we've heard from everyone we need to, and let's talk about what that looks like.
So what I can do is I can go to the different web pages, and I can get their information and try and get all the statistics that I can, and then bring everything back so that you're not just working out of the dark. You'll have an idea of what all the different organizations are doing, and then you can have a discussion from there.
Perfect. So you'll be our presenter.
Okay.
You could do it from your seat.
Thank you.
So speaking of presentations, we have a speaker card today for public business. David Paul, floor is yours, sir.
Mr. Chairman and Commissioners, good afternoon, and happy birthday, America. I love this country, and there's a transition. Things take a while to work out. And you were talking about the marijuana, the CBCs, the non-psychoactive part that helps with pain management and getting people off opioids. That'll be a little bit of a head-butting situation when that proves to be the most effective treatment. I talk a lot about personal responsibility, and the mayor has been very candid about his early years and cocaine and things like that. I used to travel in circles where there was an abundance of that. And you could have a mountain of cocaine in front of me right now, and it's not because I'm afraid of the law or not going to pass a drug test. I would not stick my nose in that because I know better. So that's the only thing that really works, is accepting personal responsibility. But why do we do that? It's to have healthy communities through relationships. Our relationships are what comes from having a sense of responsibility. And I applaud anything that leads us in that direction. I was telling a friend of mine earlier about my car, my air conditioning. It broke 20 years ago when I was coming here, and I met a mechanic who became my friend. And I'm a little emotional right now. I would visit my friend a couple times a month, just visit and stop at the shop, talk to him, see what's going on in his life. He had some problems in his relationship constantly with his wife. I found out just yesterday when I drove by, he's dead. He was shot in the head by his common-law wife, shot twice in the head as he walked out of his house. And she told the police first he committed suicide. Then she told them that the second shot was accidental. So I don't know what that matters on that, but my friend is dead. I know the woman who killed him, and it's just a huge bag of mixed emotions. So our best laid plans can go, asunder at any moment. And I think about that whole situation with a lot of regret. Is there anything I should have done, could have done? The one thing I don't regret is telling my friend Jack every time I saw him that I loved him, because there was a connection between us. He was a decent human being that was just a good person, and he accepted me, I accepted him despite our faults. And that's why, to this day, I just believe that we should always express our gratitude for those around us. Like my friend Elizabeth, I love her, and she knows that. And it's the most divine sort of love, because I adore her, I admire her, and there's nothing I wouldn't do for her. And that's how I want to feel. That's how I want us all to feel. Happy birthday, America. Thank you for what you do.
Thank you. Thank you. So next up we have Caesar. Caesar, I apologize. I can't read your writing to pronounce your last name, so I mean no disrespect, but welcome.
Hi, good afternoon, Commission. My name is Cesar Vega Magayon. I'm a prevention coordinator at Pueblo y Salud. I was listening to the presentations today and some of the discussion regarding the opioid issue. I think when we decide what people to target and what would be the most effective, I think we have to talk about the prescribers in our community. The 93534 zip code in the city of Lancaster has the second highest prescribing rate in the county. 93535, 93534, and 93536 are in the top 10 for emergency room visits for opioid overdoses in the county. There are so many prescriptions in the city of Lancaster that we could give each man, woman, and child a prescription of opioids. We also have extremely high rates of overlapping prescriptions for opioids and benzodiazepines, which are black label contraindicated. And actually most opioid overdoses, or not most, excuse me, quite a sizable percentage, involve benzodiazepines. We know that the county and the state have tried to bring prescribers together. High Desert Medical System, Palmdale Regional Medical Center, and Antelope Valley Hospital have addressed their prescribing practices, but for some reason we can't seem to get those numbers down. We are never going to be able to address the overdose and illicit opioid issue if we don't address the high rates of prescriptions. So in terms of where this commission goes forward, who to contact, we need to bring those prescribers who aren't yet embracing those better and safer prescribing practices, and we also need to talk about the number of prescriptions in our community. Our community lost a safe medication disposal site when the county took them out from every single sheriff's station in the county. The only places where people can dispose of their leftover opioid medications or benzodiazepines is at the Kaiser Permanente pharmacy during their hours or once a month at Palmdale Sheriff's Station. We have a tremendous issue in this community regarding those prescriptions, and we know that over 60% of people who receive opioids that aren't prescribed to them actually get them from family members, whether the family member knows it or not. So we need to have those conversations, and those are the entities that need to be part of this discussion. We need to talk to our doctors. We need to talk to psychiatrists, because psychiatrists are actually the #2 group in the state of California that prescribes medications. And we need to make sure that their prescribing practices are in line with the best practices for the industry, and that we address the tremendous flood of opioids that are just lying in people's counters and in their drawers. Thank you.
And I totally agree with that. And that, and Caesar, you missed the meeting. We had a very long discussion with the head of the psychiatric department at AB Hospital and one of the head emergency department doctors as well, really to address that very issue. There's a mid-level provider at Antelope Valley Hospital. His name is Dan Payne. It's Payne, I believe is his last name. But he came up with, there's the Dan Payne pain management program that Antelope Valley Hospital follows, and it allows us to, and I believe that Palmdale Regional, some of the other clinics and Kaiser follow the same guidelines of the Dan Payne pain management program that allows us to be able to track what's going on so that we don't have the abuse and the frequent flyers going from Palmdale to AV to High Desert to Kaiser, wherever, whoever, to try to just get the prescriptions. So we did hear about that, and I agree. That's an absolutely huge issue, So that's definitely part of the discussion, so thank you. Okay, professional bull riding and fireworks tomorrow night on a better topic. So go have a good time. We'll go ahead and adjourn. Actually, can't adjourn the meeting, so we can't do anything, so we can stop, right? I guess technically I can't call it over. So it's over. Happy 4th of July.